Welcome to the deep dive. Today, we're tackling a subject that honestly might surprise you with just how big a deal it is. Lameness in cattle. Now, you might picture just, slight limp, but this is a massive issue globally. It's consistently ranked as one of the top health problems for cattle, and it's incredibly significant economically speaking.
Absolutely.
We're talking serious pain for these animals, which obviously impacts their welfare hugely. And then there's the hit to farm profitability, things like lower milk yields, slower growth, problems with reproduction, more animals being culled, and even higher death rates. It's quite profound.
And what makes it so challenging, I think, is the complexity. It's rarely just one thing. We call it multifactorial because there's this dynamic interplay between so many different elements. Genetics, how they're fed, their environment, day-to-day handling. It all connects.
Like a complex puzzle, you said.
Exactly. Every piece really affects the others.
Okay, so that's our mission for this deep dive. This is actually diagnosed, and the ways it's managed and hopefully prevented. We're aiming for that holistic view you mentioned to really understand its wide-reaching impact. So let's just pause on the scale of the problem for a second. Before we get into the nitty-gritty of causes, let's underline this again. It's not just a bit of discomfort. It's a major source of pain impacting huge numbers of animals, both dairy and beef. It really challenges animal well-being and, frankly, the sustainability of farms.
You've hit the nail on the head. Lameness is fundamentally a locomotive disorder. It impairs their ability to move. And think about what that means. Difficulty getting to food and water, interacting normally with the herd, even just lying down comfortably. The severity varies, of course, from a barely noticeable limp to an animal unable to put weight on a leg. And that variation just highlights why you need a really comprehensive approach to manage and prevent it. You have to look at everything.
Right. Okay, let's unpack this then. Where does lameness actually start? You said it's complex, so it feels like pinning down one starting point is tough.
It is a web, definitely. But statistically speaking, the vast majority, maybe 80 to 90% of cases, actually start in the hooves. And it's more common in the back legs, the hind limbs, mainly because they carry more weight.
80 to 90%. Wow, that's huge. All starting in the hooves.
Predominantly, yes. And within those hoof problems, we generally split them into two main camps: infectious causes and non-infectious causes.
Okay, so let's start with the infectious ones. What are the big players there? I think I've heard people mention hairy heel warts. What's that about?
Ah, yes, hairy heel warts. It's a very descriptive name for digital dermatitis. It's mainly caused by a type of bacteria called treponema. They're spiral-shaped, and they just love moist, dirty conditions. So things like wet bedding or muddy areas.
And they spread easily.
Very easily, especially when cattle are housed closely together. The lesions themselves are typically quite painful. They look like raw sores. Sometimes they even cause a tissue to die off. And yeah, they can develop this sort of rough, hairy, or wart-like surface, usually right around the heel.
Okay, sounds nasty. What about foot rot? Is that related?
Similar sounding name, but actually quite different. Foot rot, or its proper name, interdigital phlegmon, is a necrotic infection, meaning tissue death, again, but this time it starts in the skin between the claws. The main culprit here is usually Fusobacterium necrophorum, a bacterium that's pretty common in soil and manure.
So how does it get in?
It needs a way in, usually some kind of damage to that skin between the claws, maybe from walking on rough ground, sharp stones, even coarse stubble. And then, just like the treponema, it thrives when that skin is constantly wet and soft and take. Macerated is the technical term, by water, manure, urine.
And the symptoms?
Usually quite sudden, severe lameness, often a fever too, and because it hurts so much, the cow will likely go off its feed.
It really highlights how important the environment is, keeping things clean and dry.
Absolutely critical.
Are there other bacterial hoof issues worth mentioning quickly?
Well, there's also interdigital dermatitis, which is kind of a milder inflammation of that same skin between the claws, and heel horn erosion, where the back part of the hoof horn gets worn away. Both are linked to bacteria and can sometimes pave the way for more serious problems if they aren't managed.
Okay, so those are the bugs getting in from the outside. What about problems originating inside the hoof, the non-infectious kind?
Right, that brings us to a really important one, laminitis. This is an inflammation of the sensitive laminae. Think of the laminae as the structure that holds the bone inside the hoof capsule, kind of like Velcro, or how your fingernail attaches to your finger. When that gets inflamed, it's serious trouble.
And what causes that inflammation? It's not a bacteria this time.
No. Laminitis is complex. It can be triggered by nutritional factors and environmental ones. Nutritionally, a common cause is a sudden drop in the rumen pH, the acidity in their main stomach compartment. This often happens with diets too high in grain or concentrates or sudden feed changes. That metabolic shock affects blood flow to the feet.
Interesting. And environmentally.
Things like spending too much time standing on hard concrete floors, stalls that aren't comfortable or don't have enough bedding, overcrowding, even heat stress, or being kept waiting too long and holding pens before milking. All these stressors can contribute.
So seemingly small things can add up to this big internal inflammation.
Precisely. And chronic or long-term laminitis can lead to some really severe hoof changes. Things like slipper hooves, where the hoof grows really long and distorted because the internal connections are damaged. You also see fissures or cracks appearing, bruising under the sole, bleeding. And eventually, it often leads to sole ulcers.
You mentioned sole ulcers, so they're often a consequence of this laminitis.
Very often, yes. Sole ulcers are these chronic, incredibly painful sores, often with pus, right in the sole of the hoof. They're strongly linked to that chronic laminitis damage. But they can also be related to just poor hoof shape, like something called a screw claw, where the claw twists abnormally, putting pressure in the wrong places. And walking on hard surfaces just makes it all worse.
Okay. And what was the other one you mentioned? White line disease?
White line disease, very common, especially in dairy cows. This is more of a mechanical separation problem. The white line is the junction where the hard outer wall of the hoof meets the softer sole. In this disease, that junction weakens and separates.
Like a gap opening up.
Exactly. And that gap allows dirt, little stones, bacteria to get packed in there, leading to infection and often abscesses forming deep inside the hoof. Extremely painful.
So we've got infections, inflammation like laminitis, separation issues. Are there also just straightforward physical deformities of the hoof itself?
Yes, definitely. You can get horn fissures, which are basically cracks in the hoof wall. And then there are various claw deformations. Sometimes claws grow unevenly, one side bigger than the other, that's asymmetric. Sometimes they twist as they grow, that's a corkscrew claw. You can even get an extra little claw growing between the main two, an interdigital claw, or claws that cross over each other, called scissor claws.
And all those odd shapes must mess with how they walk.
Absolutely. They lead to abnormal weight bearing, putting stress on parts of the hoof and leg that aren't designed for it. And that, in turn, makes the animal much more susceptible to those other problems we talked about, like sole ulcers or worsening laminitis.
Okay, so we've covered a lot happening in the hoof or directly to the hoof. But you mentioned the environment earlier. Let's broaden out. What about just plain physical trauma, things that cause injury beyond the hoof itself? This is where it gets really interesting, right?
Yeah, direct trauma is a big one. Slipping and falling, for instance, is a major cause of fractures, especially on hard surfaces like concrete, which is common in many barns. Stifle injuries, that's like their knee and hip injuries, are unfortunately quite common in adult cattle from falls, and those can be career-ending, essentially.
And I guess it's not just accidental falls. What about collisions?
Yes, collisions happen too. Sometimes calves get stepped on accidentally by larger herd mates. Collisions with farm equipment can occur. And another area is during difficult births, what we call dystocia. If a calf needs assistance being born, improper pulling techniques can actually lead to limb fractures in the newborn.
That's awful. So many ways for physical injury to happen.
It doesn't stop there either. Sometimes animals that are already down, maybe from milk fever, can rupture muscles just from struggling to get up. And, though less common, there's even iatrogenic trauma injuries caused accidentally during veterinary procedures if things don't go perfectly.
Wow, okay. So physical impacts are clear. How does the general housing and management setup contribute then? The everyday environment.
It plays a huge role. Housing systems themselves, especially flooring. Dairy cattle kept indoors, for example, often suffer hock and knee injuries, abrasions, swelling just from repeated contact with abrasive surfaces like rough concrete or poorly designed stalls. If the stalls aren't designed well, maybe the base is too hard or there isn't enough soft bedding. That constant pressure and rubbing causes problems.
And you mentioned wet conditions for infections, but does that general dampness cause other issues too?
It absolutely does. Spending a lot of time standing in wet manure and urine, or slurry, doesn't just encourage bacteria. It actually softens the hoof horn itself.
Really? How?
Well, the moisture itself softens it, just like soaking your own nails. But also, the urea in urine has a chemical effect that makes the horn more pliable and weaker, more easily damaged.
That's fascinating.
And then you add in factors like overcrowding, which increases the chance of being stepped on and spreads disease faster. Rough walking surfaces outside, like paths with sharp stones or gravel, cause direct hoof injury. Even the feed itself can sometimes cause trauma. Really coarse forages or feeds containing sharp plant parts can damage the mouth, leading to infections that might indirectly affect the animal's overall health and willingness to move.
Okay, this brings us neatly to the nutritional side of things. These seem like less obvious connections, but you're saying what a cow eats is crucial for its mobility.
Absolutely fundamental. Let's start with minerals. Calcium and phosphorus are the big ones for bones, right? If there's a deficiency, or even if the ratio between them is wrong in the diet, it interferes with bone formation. In young animals, that causes rickets. In adults, osteomalacia. Essentially, weak, brittle bones that fracture easily. Phosphorus deficiency alone can also cause stiffness and lameness.
Okay, calcium and phosphorus for bone structure. What else?
Magnesium. It's vital for nerve and muscle function. Severe deficiency leads to a condition called grass tetany, or hypomagnesemia. This causes neurological signs, staggering, muscle tremors, convulsions. Clearly, an animal in that state is at high risk of falling and injuring itself badly.
Right. Any other key minerals?
Yes, several trace minerals are important. Manganese, copper, and selenium, often working together with vitamin E, are all involved in healthy bone, cartilage, and muscle development. Deficiencies can cause various problems, including something called white muscle disease in calves, where muscles degenerate, making them weak and unsteady. We even need to watch out for toxicities too much nothing. Sulfur or sodium can cause neurological problems, again increasing the risk of falls.
So minerals are critical. What about vitamins?
Also very important, vitamin A deficiency can cause night blindness, making animals more likely to bump into things, but also neurological issues. Vitamin D is essential for the body to actually use that calcium and phosphorus we talked about, so a lack of vitamin D also leads back to rickets and osteomalacia.
Okay. And B vitamins.
Yes, particularly thiamine, which is vitamin B1. It's crucial for brain metabolism. A deficiency can lead to a serious neurological disease called polyencephalomalacia, or PEM. Essentially, parts of the brain soften. Animals become disoriented, they might seem blind, adopt a stargazing posture, become uncoordinated. Clearly a major risk factor for falls and injury.
That link between diet, brain function, and physical injury is really stark. Are there any major metabolic diseases that directly tie into lameness risk?
The big one, especially in dairy cows, is milk fever or hypocalcemia. This happens right around calving time, when the cow suddenly needs huge amounts of calcium for milk production. If her body can't mobilize it fast enough from her bones or absorb it from her diet, her blood calcium levels plummet.
And that causes
Acute paralysis. The cow literally can't stand up. She becomes a downer cow. And being down like that significantly increases the risk of muscle damage from pressure, nerve damage, and of course, fractures if she struggles violently or falls awkwardly when trying to rise. It's a very common and costly problem.
Okay, so we've explored this huge range of potential causes: infections, structure, trauma, environment, nutrition, metabolism. Wow. So when a vet or a farmer suspects lameness, how do they actually figure out what's going on? What's the diagnostic process?
It's a systematic approach, really. It usually starts with observation, a careful clinical exam. The vet will watch the animal walk, looking at its gait, how it carries its weight, its posture, trying to identify which leg or legs are affected and how severely.
Just watching them move?
Exactly. Then comes the hands-on part, carefully examining the limbs and especially the hooves for any swelling, heat, pain response, visible sores, or abnormalities in shape. Often they'll use hoof testers. They look a bit like large pliers to apply specific pressure to different parts of the hoof sole and walls to pinpoint the exact location of pain.
Okay, like detective work for the feet. What if the problem seems deeper?
Then imaging comes into play. Radiography, or X-rays, are great for looking at bones and joints, checking for fractures, arthritis, or changes related to laminitis. Ultrasonography is better for looking at soft tissues, like tendons and ligaments, or fluid buildup in joints.
And lab tests?
Sometimes, yes. If there's suspicion of a joint infection, for example, they might take a sample of the joint fluid for analysis and culture to identify the specific bacteria involved.
Right, makes sense. A very thorough process. So once the cause is pinpointed, what can actually be done? How is lameness treated and, ideally, prevented?
Treatment really depends on the specific diagnosis, of course, but there are common strategies. Hoof trimming is fundamental. Regular, skilled hoof trimming helps maintain the correct shape and balance of the hoof, removes overgrown horn, and can help treat minor lesions. It's preventative and therapeutic.
Okay, trimming first. What else?
Foot baths are widely used, especially for infectious hoof diseases like digital dermatitis. These are baths the cows walk through containing an antiseptic solution like copper sulfate or zinc sulfate to kill bacteria on the hoof surface.
Disinfecting the feet, basically.
Precisely. Then, for active infections, antibiotics might be needed. Sometimes topical treatments, like an antibiotic spray directly onto a lesion like digital dermatitis. For deeper infections, like foot rot or a joint infection, systemic antibiotics given by injection or orally are necessary to reach the site of infection.
And managing the pain must be crucial, too.
Absolutely vital for welfare and recovery. We use nonsteroidal anti-inflammatory drugs, or NSAIDs, things like flunixin, meglumin, or meloxicam. These reduce both pain and inflammation, making the animal more comfortable and encouraging them to move more normally, which aids healing. Think of them like prescription-strength ibuprofen, but for cows.
Okay. Any other treatments?
In some severe cases, like complicated sole ulcers, deep abscesses, or certain fractures, surgical intervention might be required to drain infection, remove damaged tissue, or stabilize a bone.
Right. But ideally, we want to avoid getting to that point. Prevention seems key.
Prevention is absolutely the cornerstone of managing lameness effectively in a herd. It requires that holistic view we talked about.
So what are the key preventative steps?
Several pillars. First, excellent hoof care and hygiene. That means regular routine hoof trimming for all animals, not just treating lame ones. And maintaining clean, dry environments. Good bedding management, regular scraping of walkways to minimize contact with manure and moisture.
Makes sense. Keep the feet clean and well-maintained.
Second, nutritional management. Ensuring the diet is well-balanced, especially around critical periods like calving, to prevent metabolic diseases like milk fever and laminitis. Providing the right balance of minerals and vitamins for strong bones and tissues.
Diet is foundational.
And third, environmental modifications. This is about making the cow's living space as safe and comfortable as possible. Improving flooring, maybe adding rubber matting in high-traffic areas, grooving concrete to prevent slips, providing comfortable stalls with plenty of soft bedding, and avoiding overcrowding to reduce stress and physical injury risk.
It really sounds like creating an optimal environment is just as important as direct hoof care.
It really is. It's all interconnected.
Wow, okay. We have definitely covered a lot of ground today. From, tiny specific bacteria causing things like foot rot, right through to the mineral balance in feet affecting bone strength and how the design of a barn floor impacts joint health. It really underscores just how comprehensive this issue of cattle lameness is.
It really does. And I think, hopefully, understanding that complexity makes it clearer why tackling lameness effectively means looking at the whole picture. The animal itself, what it eats, how it's managed, and the world it lives in. It's that integrated approach that really yields the best results, both for the farm's bottom line and, crucially, for the animal's welfare.
Absolutely. And it kind of leaves you wondering, doesn't it? Thinking about our own lives, what are those deeper connections we might be overlooking?
Yeah.
Between seemingly separate things like maybe the quality of our food and our long-term joint health, or how our workspace is designed and our daily physical comfort. Maybe there are more holistic connections we should be considering for our own well-being, too. Something to think about.